Democratic senators say that prescription drug prices will be a key component of their health care strategy heading into this year's midterms. Ranking member of the Finance Committee, Democratic Senator Ron Wyden of Oregon, says his party plans to supercharge Medicare drug price negotiations and to go after middlemen. That promise comes after new polling reveals that a majority of Americans think the healthcare system in this country is broken, with 6 in 10 people reporting a recent problem with their health insurance company. Joining us with more on the Democratic strategy for healthcare, political strategist Adrian Elrod and pollster and messaging strategist John Anzalone. Great to see you both. Adrian, starting with you, we know that in Democrats last year said, look, we see the formula that works. It's affordability. This year, with all that's happening in Minnesota and other places, we've got to talk deportation. We have to talk about ICE tactics as well. But you guys are saying, look, and Senator Wyden, among others, hey, health care, prescription drugs, a big part of this, too.
Well, Lemire, first of all, thank you for having us. As you pointed out, the issues, like ICE being too aggressive, immigration, those are issues that are important to the American people. But I think it's important that we not lose sight of the fact that affordability is still a key driving force going into the midterms, and healthcare is very much a part of that equation. Some of the research that you'll hear from John here in a second that he's done is he's really done some deep dives into how do we actually talk about this. I think sometimes Democrats, we know that healthcare costs and affordability are huge issues to the American people, but we don't always talk about it in the way that impacts voters and meets them where they are in terms of their everyday lives. I think, one of the biggest misnomers that Democrats have done on healthcare messaging over the past 20 or 25 years or so is saying things like, oh, government should use its bulk purchasing power to lower the cost of prescription drugs. A lot of people don't trust the government, and they don't know what bulk purchasing power means. So I think some of the research that John and his team have done into how Democrats can be talking about this and meet voters where they are is incredibly important.
So, John, talk to us more about that. No secret that Americans are unhappy with health care and their health insurance companies. What do you think the right message is?
I think this is very much about just listening to what people have to say about their own lives, right? And, I think D.C. and Congress doesn't really do a good job of listening. And so, you led off, for example, about prescription drugs. Super important, without a doubt. Medicaid cuts, ACA subsidies, really important. We should deal with all of those. But in our most recent Wall Street Journal poll, for example, people cited health insurance costs 4 times more important in terms of their concerns with any type of cost of living issue than prescription drugs. And maybe even more important, when we ask, what can Congress and the president do on cost of living? All of a sudden, while groceries was the most important pain point in terms of their daily lives, what they believe Congress can do, health insurance becomes that, right? 54%, then rent, et cetera. And again, you can see prescriptions down a little lower at 14%. So I'm not sure that D.C. is listening. And what we find is that 58% of voters said they've had a problem with their health insurance company in the past year. And so if you really talk to people, what their concern is with not only health insurance costs, it rises 6% a year, regardless of what they can do about it. They don't have any control. But 66% say that insurance companies, denying coverage that was recommended by their doctor is a major concern. So here we have basically people saying, I have no control over my health care. I get price increases every year that I don't get a say in. But more importantly, I pay for something I don't get, which is they keep getting claims denied where their doctor says, you need this treatment, you need this diagnostic, you need to go to the specialist. And so on paper, they're covered, and in reality, they're screwed. And I think that is what we see as the main issues out there, including surprise billing. And doesn't seem like Congress is talking about these important issues.
So, John, on surprise billing, I know this is something that you've done a lot of research into, and it's something that a lot of Americans, regardless of their economic status, are facing. You could be an upper middle class American, and if you get slapped with a $2,000, $3,000 bill that you weren't expecting after you went to a doctor's appointment and did everything your doctor said, and you're paying sky high premiums, You always talk about this is the 80% versus the 20%. Sometimes Democrats are only talking to that 20%. Right. Can you sort of expand on that?
I think that's a great point. The 20% is super important. I mean, whether you talk about people who are on Medicaid or people who are on ACA and get a tax credit, those are really important, and we need to fix those. But literally about 80% of America either gets their health insurance through their private employer, right? Mm-hmm. They pay part of that. Or through Medicare, which, quite frankly, 70% of them also get additional private coverage. And so we're dealing with about 75, 80% of Americans who are dealing with these issues of denied coverage, of getting price increases every year that they feel out of control, and getting surprise billing as well. And so they don't feel like they're getting what they pay for. But maybe more important is they feel completely out of control, right? They have to fight their health insurance company for everything that they're paying for. And the health insurance company often just absolutely wears them down. And what I would say about the cost of living is, you kind of get pissed off about grocery prices, but you can go from, beef to chicken. I remember growing up, we would go to, chicken livers, right?
Sure.
But the fact is that when you're dealing with healthcare and cost of living and these denial issues, you're talking about the emotion as being scared. That's what we get in focus groups when we talk about people. These things are scary. And we see from the Wall Street Journal poll that when you talk about the cost of living and what the president and Congress should be doing, they say health insurance because they believe that they actually can do something about it versus groceries, which they can't.
Such an important conversation, and one we're going to continue to have in the weeks and months ahead. Pollster and messaging strategist John Anzalone and political strategist Adrian Elrod, our thanks to you both.